one, another one, then I found this set of 5. Now there's sets of 8.
eBay for $15. You could get a set of, I think, 5 or 6.
Okay.
And
they have sets of 8 now, as
Yeah.
I understand it. Now, when you're doing this, I do this first visit every patient, except like if they walk in with a wrist or an ankle problem, something like that, I don't do it. If they come in with several issues, I do this. Now, so okay, I want you to tell me if you hear more in one side than the other, or if it's about equal. Okay. And notice that I always hit it in front of them, because if you hit it over here, they may think they hear it there because they heard it first. So you always want to do it right in front of them. Okay. Does you hear it more on one side or the other, or equally?
Can we try that one more time?
Okay. Here's it more on the left. More on the right.
Oh, that's smart. You put them on whichever side.
Yeah.
I see.
If they're sitting here, I put.
I was writing things down, and I'm like, well, this is taking too long to write left and right. And
yeah, just lay it on the side that they're hearing it in.
Smarty pants.
Okay.
I'm not sure. That might
About
be equal.
Okay.
Maybe a little more on this side.
You know, when you're seeing a high flow of patients, you tend to get really utilitarian, simplify things.
Don't really hear that one at all.
Not hearing it at all. Okay. You're going to get those. We're going to put that right here. Now, okay, you've all used the earlobe pull, right? Mm-hmm. And you probably all injured somebody using the earlobe pull. So I got away from that.
Or at least heard a lot of complaining about it.
A lot of complaining. So I started considering the tragus, which I don't know anybody else that does the tragus. I used to do it just in the middle, but then I started finding that when you press at the base, you can go like the superior, the middle, the inferior. Now the superior here, it gives really well. You feel that?
Yeah.
The middle here, there's some
a little, but
rigidity.
not as much.
Right here, a lot of not giving here. So you're going to press with your finger in as far as you can at the base. Now you got some good give all over, right?
Yeah.
Then you're going to pull out in all of those. And you're going to do the same on this side. Feel that lack of give there?
Yeah.
The good thing about doing this is the patient feels it. The patient feels the give or lack thereof. So you're going to push in, you're going to pull out. If it's restricted pulling out, you flap it back at the base and you tap it out. Going in, the restriction, you press it in and tap it. Okay? Now just consider if there is a sudden loud noise. The outer 1/3 of the ear canal is cartilage, and then it's bone going right up to the tympanic membrane, right? So if that's loud sudden noise jams those structures in, it goes right up against the tympanic membrane, then the ossicles are right up against that, so it's affecting the vibration of those ossicles, okay? Let's say that you're trying to clear your ears, like this. Now you have a sudden outward pressure. So it jams it out and it tractions the tympanic membrane away from the ossicles, causing another issue. So we normally find, when I find this, I ask the patient, okay, do you normally, when you're in a crowded place, like a restaurant, have trouble hearing the person away from on the other side of the table?
Yeah, I can definitely. I mean, I try to focus in on them.
Right. Or you're on the phone and there's a lot of background noise. You have trouble hearing them, right?
Right.
There's always a yes on this when you're finding this. And patients, you'll find, will come up and say, when are you going to do that tuning fork thing again? Oh, you're hearing people better across from you. Yeah. Then I started getting wise, and I started immediately retesting. Okay? Right after I did the correction. About equal.
About
right?
equal. I hear it more on the left, but it's more equal than
More
it
equal.
was.
Okay.
Both. That seems equal.
Pretty equal again. That was the right side.
Don't hear anything. I don't think. You know, I don't know if I hear anything or not with that one, or it might be about equal.
Okay.
Not sure. Maybe a little on the left.
Okay, this one he didn't
Couldn't
hear
hear
at all.
before.
Now it's just a little bit more on the left, so he gains some. Now, occasionally you're going to have this. You're going to have dips and ebbs. You may have to treat somebody a few times because there may be some scar tissue back in there. Okay, so you got to do it multiple times. Okay. Now, did you have ringing in the ears or a lack of hearing?
I've got both. I mean, ringing in the ears not all the time. There's
Mhm.
different times. A lot of times when I have headaches or throughout the day at different points, I'll have ringing in the ear.
Okay.
I've got some loss of hearing in the left ear.
Okay. But that's interesting that now we got some shift in that, right? Okay. Now, does it sound any different that I'm talking to you now than it did before?
I'm not sure. I didn't focus in on it before. I
Okay.
have a hard time tuning into things. I
Now,
can hear you fine right now.
I was in Omaha for part one and treated, I said, okay, anybody have hearing problems? The older guy, his two sons were chiropractors, were there too. He came up and he says, I got hearing aids in both ears for the last 14 years. So I said, oh, let's see what happens. So I treat him. He comes up the next morning. We did that the night before. He says, I don't need my hearing aids anymore. Came back 4 months later for part two. I still don't need them. So you can affect ringing in the ears. You can affect hearing itself.
Did you
doing
have them
this
take
stuff.
their hearing aids out before you test them with the tuning fork?
Yeah.
With the ringing in the ears, like if a person does have that on a regular basis throughout the day,
Mhm.
it can help them.
Yeah.
Yeah, it's just
You
not.
just have to have her retreated a few times, probably to get the old scar tissue jarred loose. But this is what I call a good start. Whenever I treat somebody the first time, like in part one, they couldn't feel the pinwheel. They couldn't feel the vibration of the tuning fork. I immediately redo it. And they go, golly, I can feel it now. I say, that's a good start. Okay? So they know that isn't all that I'm going to do on them, and they aren't well yet. They know it's a good start, and they're amazed at what just happened. Okay? So that's a good start.
All right.
Okay?
Thank you.
Okay, so everybody,